Welcome to the United Way Difference, a program that discusses Oshkosh community needs and how local nonprofit agencies are supporting people in our area. United Way's focus in the areas of income, education, health, and volunteerism helps to build a stronger, more caring, and compassionate community. The United Way Difference is brought to you by the Oshkosh Area United Way.
Hi, I'm Sue Ponick with the Oshkosh Area United Way. Today we're going to tackle kind of a tough issue, and that is the issue of drug and alcohol. My guest today is Stephanie Gillen. I'm going to say it right. I had it right the first time.
Do you want me to say
Yeah,
it?
say it for me.
I'm Stephanie Gilden Van.
Thank you. It's not such a tough name. I have this problem with it. Stephanie Gilden Van, who is the coordinator of the Winnebago County Drug and Alcohol Coalition. But actually, Stephanie, you hold two different roles within the health department, right?
Sure. So I am the Drug-Free Communities Grant Coordinator. So our health department, Winnebago County Public Health, has a grant to address substance use. We've had that grant for 8 years now, 8.5 years, and so we're in the last 1.5 years of that grant. So my job is to coordinate the initiatives that our health department is working on around substance use. And one of the largest initiatives is engaging the community to really address substance use in our community. And we do that through the Winnebago County Drug and Alcohol Coalition. And we also do it through the alcohol team that's part of Rethink, which is the coalition that is tied to our health department.
Okay, so one of the things that we wanted to talk about is what is the Winnebago County Drug and Alcohol Coalition? Tell me more about it.
Yeah, so the Drug and Alcohol Coalition initiated itself in 2013 as part of the Heroin Task Force. So many people may be aware of the Winnebago County Heroin Task Force. And that in the last year transitioned from a task force to a long-term coalition.
Okay.
And the Winnebago County Drug and Alcohol Coalition is made up of a number of sectors in our community, from law enforcement.
Okay, we're going to get to that, but let's talk about the mission first.
Sure. So our mission is we're wanting to prevent and reduce drug and alcohol use in our community. And we're doing that by engaging the community, empowering the community, and also helping people that need to access services to address substance use, that they can also do that. So we're trying to do individual change and social change and community level work as well as individual level work.
Okay, now you originally said that it formed from the Heroin Task Force. Why did it expand its just from heroin now to drug and alcohol use?
Certainly heroin hasn't gone away in our community. It is still a forefront issue, and it's certainly one of the main reasons that we're seeing overdose deaths. But heroin is not the only drug that is in our community, and it's certainly not the first drug that many people find themselves perhaps addicted to. So we know to really address heroin and other opiates, we also need to look at other drugs that are in our community. And we know over time the drug trends change, and the addiction is really the issue that we need to address in our community.
Okay, so let's now go to the coalition team and who makes up this entire coalition, not just the team members, but...
Yeah, so we have a leadership level team, that's the steering team, and they really help do the direction and oversight of the whole coalition. They also work to ensure that there is training and leadership opportunities for people to learn and help lead the coalition across our community.
So who's on that steering committee?
So there is treatment providers, there are people in recovery, there's parents that are affected, we have law enforcement around that table, persons representing school districts, yourself is on that the steering team, and it's really a multi-sector approach to help oversee. And then there's individuals from each of the other teams that are represented on the steering team so that we move together fully as a coalition in our work.
Right, and I think what's really cool about it is the fact that we have the healthcare systems involved. We have all three police departments involved, the county, the city, and the school, and the Oshkosh, University of Wisconsin-Oshkosh, as well as having the voice of the families represented, which I think we learn so much from.
Yeah, having people impacted, involved is powerful, and it brings urgency to the work that we do, and I think it keeps all the people around the table very accountable to our work.
Well, we talk about communications a bit, and you talked about focusing on the awareness piece. I know that I've been out in the community, and I sometimes hear that people just think that being addicted to a substance is you're just weak. or you have no willpower.
Yeah.
But it's more than that. So how do we communicate the urgency to get people to treatment, but also just the awareness of what the issue really is?
So one of the things that we're working with our communications team is to certainly help people understand what is addiction in our community, what are the current issues around drugs that we have in our community. But the other
How
piece,
broad an issue it is?
yeah, how broad and how it changes over time. There's
Okay.
never one point where like this is the specific drug that we have in our community. It changes over time.
We had talked about at a previous meeting about the fact that, you know, we were focused so much on heroin, but now actually meth is really on the rise again.
It is. It's what we're seeing from law enforcement reports, as well as just hearing from people that are in the recovery community, as well as others that are out in the community. We're hearing more and more that meth and other drugs are on the rise.
Okay.
So the other piece that communications is working to shed a light on is addressing stigma. So we've come a long way in the area of mental health to identify the person that might need help or assistance and really bring our community around that. And I think we have a ways to go yet when it comes to substance use. So we do like to typically show the pictures of the needles and the pills on like news segments because it gets a lot of attention. And we like to think that the person that might have addictive issues looks a particular way or is low income, or there's all these things that we tie to it. And really, addiction impacts everyone, and it impacts our whole community. But there's not one kind of person that has struggled with addiction.
Right. So if I can't say to you, what does a typical drug addict look like? Because you can't tell me that. There is no typical drug addict.
Right, and the issue is it's really a disorder. It's a substance use disorder. So just like any other disorders, people need help. So just locking people up or arresting your way out of crime, law enforcement and other agencies are around that table to really figure out how do we get to the root cause of these issues, because they know that these kind of criminalizing the issue isn't necessarily what's going to get people the help that they need.
Right. You know, a number of years ago, we looked at alcoholism as a disease, and there's treatment for that. But we don't have that same view of other substance abuses, or other substance use. I guess I'm not quite sure what my question is here. But if we look at alcoholism as a disease, then we should look at other addictions as diseases. Yes.
Yeah.
Okay.
It is a disease.
Yeah.
It's a substance use disorder. So I think people sometimes can connect to alcohol really easily because it's something that's prevalent in our community. It's socially acceptable in our community. Perhaps we have unhealthy culture around alcohol in Wisconsin. But it's harder to imagine like a person that might use intravenous drug like heroin and things like that. But the heart of the matter is the same. It's a disorder. It's a condition that people need help with.
Right. So we were talking a little bit about treatment, and here we're talking about the access, or increase the access to treatment, and then improving the navigation. What do you mean by that?
So if you could imagine having a loved one that really needs help, would you know what the first step is to connect that person to help? A lot of people...
I would call 211.
Okay, that's an option that's out there, and it's a good place to start. But just helping people understand the horizon, like you need to get an assessment, and then after the assessment, you need to find a provider, a person that can offer treatment services. But also your insurance comes into play, and if you do have insurance versus if you don't have insurance, there's options out there. But a lot of people are unfamiliar with what's the path to get to the help you need. So we're trying to make that a little bit more clear for people in the community to understand, and also understand that we actually are pretty rich in treatment services in the greater Fox Valley area. There's some parts of our community that really have very limited options for treatment.
You mean statewide or just here?
Different pockets around the state. Certainly when you're in the more rural areas of the state, there's limits. We in the Fox Valley specifically have a strong recovery community, and we also have strong treatment options. You can choose between inpatient services and have a variety of options, as well as outpatient services. So we have a good amount of resources. We're still looking into, do we have enough resources? And is there too long of a wait, and for what reason? So that's part of the access to treatment. Affordability is part of the access to treatment. But the biggest piece right now is a lot of people know that they may need help, or they know a loved one that may need help, and they don't know the first step to get that person
Right.
to the help they need.
And then also we talk about peer support, but that's once somebody has been in treatment, yes or no?
It can go either way.
Okay.
So when you're talking to people in recovery, they wish that people could see that recovery really starts even before treatment.
Oh.
So having that peer support when a person might be in active addiction and then realize that they want help, to have a person that is either a trained peer support specialist or a recovery coach be able to talk with that person and help them get connected into treatment has been shown very accessible.
Okay, so the next piece, then you talk about the data. So, you know, it's nice to be able to have just-in-time data, but can you get that?
So this is something that's different with our coalition than what you see with typical drug and alcohol coalitions. We decided to have a data team because we wanted a data-driven response to the work that we're doing in the community.
Mm-hmm.
So data it certainly had been difficult in the past to get something more relevant than 2 or 3 years, and we are moving into a point where data collection is happening pretty quickly, and we want to bring a local lens to that.
Okay. Well, I know one of the things that the coalition had been working on was trying to get some real stories. And we
Yeah.
have a story of Andrew Edwards that we want to show now. So if we can get that pulled up, and while that's going up, maybe we can just chat a little bit about some of the success stories that you've seen.
So I think something Andrew will point to in the story that he has to share are some of the resources, again, that we have in our community, like the drug courts and other programs that we have that didn't just, again, take the person and, I mean, Andrew found himself in trouble with the law like some people with addiction issues do, and he was fortunate enough to get into a drug court program
Okay.
that gave him the help that he needed.
And how did that work for him? I mean, how does drug court really work?
I think you'll find out in the story.
Oh, that's true. Okay. But some people aren't that fortunate, or they don't know what to do.
Sure.
So, I mean, you go back to the navigation and where to start. Even how do you come to grips with the fact that you or somebody you love has a problem?
Yeah, and ideally you're looking at prevention from an early age on. So a lot of what we're doing at this point is trying to get people the help they need, but that's after they have a diagnosable issue.
Mm-hmm.
So looking at how we can actually get to prevention from an early age on is much more successful. So looking at kids and families that have high ACE scores, adverse childhood experiences.
Give me an example of what an adverse childhood experience might be.
Yeah, so it could be maybe you're a child that experienced some sort of physical or verbal abuse. It could be a child that even grew up in a home where substance use was used right in front of them.
Okay.
So some of those experiences are hard for children to process. If, again, we can connect them to services and help at a young age to process that and identify healthy ways to cope, then we're reducing the chance and the likelihood of early onset substance use. So some of the people that, and you'll again hear in Andrew's story, that find themselves at the age of 20, 25, 30 with a diagnosable substance use issue, they started really early. They started at 9, 10, 11 years old. So really, again, getting to that prevention, we're looking at starting at an early age and identifying specifically who needs some of that extra support and help to have a healthy coping mechanism.
It was interesting this morning on National Public Radio, they were talking about the fact that more children are entering into the foster care system because children are being taken away from their parents because of substance abuse. And they talked about some of the conditions of the homes that the county social workers were finding, not necessarily Winnebago County, this is statewide.
Yes.
But they're finding that more children are being exposed to drug paraphernalia, that there's active drug use in the home. And because of that, what they consider neglect or abuse, children are being removed from the home until parents can straighten that out. Now, children can always come back to those parents, but it then kind of clogs up the foster care system, and so now they're trying to recruit more foster parents to be able to take care of the children. So it's really a vicious cycle. You don't think about one thing really affecting all those other things, but it does. And it's not just my problem that I have to deal with, but it's how my problem impacts other people in my family, in my community, and
really it does impact the whole community. So it's really, if we can get more resources and focus at the prevention end of things, we'll start to crack that cycle so that it isn't this pervasive cycle that happens over and over again in our community.
Right.
We also do need the resources at the end of treatment and recovery. But if we can get some of those resources and really targeted strategies focused in prevention, that's when we'll start to see some changes.
Okay, we're going to come back in just a minute, and hopefully we'll be able to hear Andrew's story. And it is a story of hope, and so I want people to know about that there is light at the end of the tunnel. So stay watching, and we'll get more on the Winnebago County Drug and Alcohol Coalition. Thank you.
It's not a charity, it's more than a charity. It's about helping people we live with. It's about being the type of person that the 6-year-old version of ourselves wanted us to be. It's about community and looking out for one another. It's about money, yes, but it's so much more than money. It's about friendship and common values. It's about opening doors when others are slammed shut. It's about giving kids a place to be kids and growing up knowing they live in a community that cares about them. It's about making sure that everyone gets to see the dentist, because we want to make sure that they have every last tooth in those smiles. Ultimately, that's it. It's about the smiles, old smiles and new smiles. It's about us, all of us, our community living united, because great things happen when we live united. Will you join us?
Hi, I'm Sue Ponick with the United Way, and my guest today is Stephanie Gildenvan. She is with the Winnebago County Drug and Alcohol Coalition. She also works for the Winnebago County Health Department. And we were talking in the first half about what the coalition does. And we've finally ended the segment with talking about the fact that there is hope for people who have an addiction. And we want to cut to a video right now of a young man, a local man, who has been had an issue with addiction, has issues with addiction, and has been able to go into recovery and is being very successful. So stay tuned.
For me, when I was younger, like even before I started drinking and using drugs and stuff, like I felt like out of place and different and just not comfortable like with myself. And then like the first time I drank and started using drugs, like that just, it like alleviated that, and I just felt like comfortable and at peace for once, and like that's when it really like started, I guess. Like it made me feel right. Yeah, by the time I was 12, I smoked pot for the first time. I used cocaine and opiates like pain pills when I was 13 for the first time, and then it slowly just like, well, quickly actually progressed from there. Like became everyday thing. I mean, for a while it was just smoking weed and drinking on the weekends and then dabbling with other things from time to time, but pretty quickly by like sophomore year I was physically dependent on opiates and doing anything I could really get my hands on. And I told myself when I first started, like, I'm never gonna end up like this person, or I'm never gonna end up like that person. Like I was involved in sports. I played basketball. I was started around the varsity basketball team as a sophomore, got good grades early on in high school and in middle school, and then slowly like it started like taking other things in my life started taking a back seat, started realizing like the progression of it. I started like trying to stop or trying to control it, and I like realized that I really couldn't do that. Like I'd make it, a week or a few days and then go back to it and get back on it. So it was like a baffling, confusing thing, like internally for me, like why can't I drink like other people or just go to parties, or why can't I like just use on the weekends, or things like that. And the next thing, and then one drug would wear out and then I'd no longer be getting high on that one, so I'd want to try another one, and then it was just like all bets were off really. Like I'm just kind of along for the ride, because I told myself I was never going to use needles, told myself I was never going to do heroin and all that stuff, and did it all. So it wasn't gonna get better for me until I really was done. Like I wanted to be done using and drinking. Like I didn't want anything to do with it anymore. But at that point, like if any sort of like treatment or introduction to recovery or like programs and stuff was possible, like in those intervals, like that would have been helpful. But it definitely had to like come from within me first. Like I had to realized that like drugs and alcohol were no longer like a sufficient solution for me to like make me feel right. When I finally realized that like I don't want anything to do with this, and I don't know how to stay clean on my own, and I need all the help I can get, like that was like the turning point for me. Anything that could get somebody hooked up with somebody in recovery like as soon as possible, I think would be really beneficial. Like when I look back today, like the stuff that I did in those periods of time were not anything close to like the person I am, you know, like all morals, values, cares, love, like all that stuff is not in the equation at all. Or like in the last 3-4 years of my use, I kind of just chalked it up to I'm gonna be a junkie and this is what I do and this is what I'm meant to do and I'm gonna do this till I die. And that's a horrible way to live. So I'm just super grateful for, like, I went through the drug court program. That was definitely like a good starting point. It got me like involved in recovery and the 12 steps and stuff like that, and that's where I really found like the solution. We're just like everybody else, you know, people who are addicts are like, I have some of the most awesome people in my life who are just as miserable and just causing just as much as harm as I was, so give people a chance.
And we're back. That is such a great story. You know, I mean, he goes through everything that went through his life, and then how grateful he is for the opportunity to go through drug court, become sober, and stay in recovery.
Yeah,
Yeah.
it really is a story of hope.
Yeah, we need a
So-
lot more of those, don't we?
Yeah,
And they're out there. We know that they're out there.
recovery is possible.
Well, let's talk a little bit about some of the data that we've collected. One of the things, you know, we had talked about earlier in the program, Stephanie, was the fact that, you know, alcohol for many people is the first drug. And while it is socially acceptable, particularly in the state of Wisconsin, it is a drug. And, you know, we talk about drug-related deaths, so maybe let's talk about that a little bit more.
Yeah, so in Wisconsin, the drug that is most lethal is alcohol. And it's not something that most people initially think of when they think of lethal drugs, but it certainly is. And what's even more interesting is if we go to the next slide,
Well,
that
before we do that, I want to just point out the fact that unfortunately the data lags for us. We don't really know. So the most recent stuff that we have is from 2015, which seems old, but it's hard to collect that data and to make it real. So
yeah,
anyway.
there's usually about, when you're looking at statewide information, a 2 to 3 year
Yeah.
lag when it comes to some of the information. I will say that these trends haven't changed a whole lot over time, so it's likely to be the same issue that we're looking at here now. Certainly we want to have our own local context on like how do we as Winnebago County fit into this information. But a lot of people, when they think of alcohol deaths, they think of the typical OWIs and things of that nature. But if you look at the numbers, it's really such a small portion of that.
And you know, we're listening. People might be listening to this on radio because it's simulcast. So if you can be pretty specific in what they might see if they were looking at the screen, that would be great.
So, like, if you look at the chart here, only 15% of the deaths were due to motor vehicle accidents.
That just amazes me.
Right. So alcohol poisoning would be like an alcohol overdose, and that is 18% of the deaths. Falls is an increasing number. So this is up to 37% now.
So people fall, and as a result of the fall,
They die.
They die. But
And
it was the alcohol caused them to fall to begin with.
Right.
Okay.
And so some of that is the aging population using alcohol as either they had always used alcohol, but now they also have maybe new prescriptions in their mix. And the prescriptions and alcohol don't work together, and they lose their balance, and they fall, and unfortunately they die.
And so where maybe I knew the level that I could drink at and not become totally intoxicated, now with the intermixing of the drugs, that could totally throw that off.
Right, that
Okay.
changes everything.
Okay.
Also, we know a lot of people in their older years are also facing more isolation, and so that can cause depression, and some people are using alcohol as a means to kind of help themselves cope with that. So again, but then you see a huge chunk around chronic conditions and cirrhosis as part of that. That's 42%
And that's long-term,
of the
chronic meaning long-term.
Yeah, that means
Okay.
you've been drinking for a while and it's adding up and having an impact. It doesn't even mean that you have to be binge drinking all the time. It can be just slight overuse of alcohol. So a recommendation for women is like 7 drinks in a week. Drinking more than 7 drinks in a week is what the health department would say is in excess if you're a female, a female adult. And so what we're looking at is 42% of the deaths in Wisconsin are due to people drinking too much and drinking for too long in their life. So this next slide that you see here is overdose deaths in Wisconsin, and it breaks it down by drugs over a course of time. So starting in 2006 over to 2015, again, there is a lag in the data that we have. You see opiates is like the leading cause.
And that's the top line?
Yep, the top line is opiates, and that's all opiates. So that's prescription opiates as well as heroin. And then you see the middle line where it starts in 2006. The middle line drops down to be one of the least lethal, and that is cocaine. So cocaine dropped as a drug of significance in our county. We hear that cocaine also is on the rise now. So that's not necessarily in this picture because it's 3 years old. And then lastly, the one that is on the bottom starting in 2006, that is the benzos, and that shot up much higher. And we see people using anxiety drugs and things of that nature to address, again, coping issues. So this last chart that we have here is the deaths of all drugs in our county over time. And so where we start with about 15, 16 deaths in 2009, we're up to 31, 32 deaths in 2017. So we've already had a number of deaths this year in 2018. And we know that as we're improving our prescription around opiates, some people that can't get the prescriptions that they once depended on because they used to get opiate prescriptions for years, unfortunately, which led to some dependency and addiction, that they're moving on to heroin because it's what they can get their hands on, it's accessible, and it's affordable. So heroin can get mixed in with a lot of other things can get mixed in with heroin, things like fentanyl, which is a synthetic opiate, and that is very potent, and if you don't know it's mixed in, you can take a dose that is much too strong for you and overdose and die. So we're not necessarily expecting death rates to go down in the very near future.
So we talk about naloxone or Narcan. It is the drug that, it's the blocker of the drugs. I don't know how else to describe it. So people get a shot of this, and it immediately
stops the overdose. Again, when we have fentanyl mixed in with heroin, sometimes you need a couple of doses. But we do want to make sure that the community understands if you know of someone that may potentially be using opiates, even if it's a person that's older that may have forgotten if they took their prescription already, that Narcan is available for free. The training is for free, and the information they can get through the last slide on this presentation.
So we're going to talk about these conversations, but we've only got like a minute left, so we have to be really fast. So we're holding a number of conversations in the community for people to discuss the issue of alcohol and drug use.
Yes. So there's going to be 14 community conversations overall, and it's looking at a variety of sectors because we know that substance use requires a community response. So this is a listening tour. We want to hear from the community. We want to hear the issues that they are seeing and would like to act on. And they can get more information about that whole tour on our website. It's winnebagodac.org, and there's a flyer that outlines all the dates and times. There is no cost to attend. There's refreshments, so they can check out the multitude of options coming up in April for events across our community.
And if people need to reach out to you, how would they get a hold of you, Stephanie?
Best way would be to call or email. So the slide that was just up, or my phone number is 920-232-3368.
The community conversations, you can also call 211, and they should have a list of the community conversations in the Oshkosh area if you'd like to participate in those. And I want to thank Stephanie for being a guest today. And if you'd like more information, please contact the Winnebago County Health Department.
Great.
Thanks, Stephanie.
Thank you.